Anxiety disorders. Module 3, Generalized and Social Anxiety Disorders. Generalized anxiety disorder is characterized by excessive persistent worry that occurs more days than not for at least 6 months. The worry is difficult to control and involves multiple areas of life, such as health, work, school, or relationships. Common symptoms include restlessness, fatigue, irritability, muscle tension, sleep disturbance, and difficulty concentrating. Patients often describe feeling on edge most of the time, even when no immediate threat is present. Social anxiety disorder involves intense fear of social or performance situations where the individual may be evaluated or judged by others. The person fears acting in a way that will be embarrassing or humiliating. This fear often leads to avoidance of social situations or significant distress. When exposure cannot be avoided, symptoms must persist for at least 6 months and commonly begin in adolescence. To manage anxiety, individuals may avoid social situations altogether or endure them with significant distress. Common behaviors include avoiding eye contact, speaking very little, or relying on safety behaviors such as rehearsing what to say or using substances to cope. Over time, avoidance can interfere with school, work, and relationships. Social anxiety disorder also includes physical symptoms related to activation of the stress response. These may include rapid heart rate, sweating, trembling, blushing, nausea, shortness of breath, muscle tension, gastric distress, or dizziness. These symptoms typically occur during or in anticipation of social situations where the person fears evaluation by others. When assessing generalized or social anxiety disorder, nurses focus on duration, severity, and functional impact. Key assessment questions explore how anxiety affects daily activities, relationships, academic or work performance, and sleep. Recognizing patterns of chronic worry or avoidance helps guide appropriate nursing interventions and referrals for treatment. People often use defense mechanisms to protect themselves from anxiety. Defense mechanisms are automatic coping styles that help individuals manage uncomfortable feelings, internal conflicts, or distressing memories. These defenses work by temporarily blocking or reducing emotional awareness in order to maintain self-image and psychological stability. Defense mechanisms can be adaptive, helping a person cope effectively, or maladaptive, interfering with emotional processing, relationships, or functioning. In nursing practice, recognizing defensive patterns can provide insight into how a patient manages anxiety and guide therapeutic communication and care planning. For more information on defense mechanisms, please look under the Therapeutic Communication Bootcamp playlist. Persistent worry or avoidance lasting 6 months or longer suggests an anxiety disorder rather than situational stress. Accurate nursing assessment of anxiety requires evaluating symptom patterns, triggers, duration, severity, coping strategies, and safety risks, along with substance use, medical causes, and effects on daily functioning to guide appropriate interventions.